Good afternoon, everyone, and thank you so much for joining us today. As many of you are aware, South Asia is one of the most vulnerable regions to climate shocks, and the impacts are further aggravated for the region's poorest and most vulnerable communities. Ensuring sustainable development and climate justice relies on building resilience, but unequal power relations, social inequalities, and insufficient recognition of diverse capacities constrain adaptive abilities of communities. Understanding the significance of this topic, Humanity and Inclusion India, supported by Sphere India, organized this webinar on promoting inclusive climate action and resilience building in South Asia, a panel discussion on intersectional perspectives on mainstreaming gender, disability, indigenous and local knowledge systems in climate action. It is with great pleasure, therefore, that I invite our moderator for this discussion, Ms. Annie Hunts. Annie is the Field Technical Specialist on Inclusive Disaster Risk Reduction and Climate Change for Humanity and Inclusion for India, Sri Lanka, and Nepal. She has worked for more than 20 years on disability inclusion in development and emergency contexts. Her expertise in inclusive disaster risk management and climate action, disability inclusion, livelihood, and physical rehabilitations of persons with disabilities have helped her provide key technical support to HI country programs in India, Bangladesh, Sri Lanka, Nepal, Pakistan, Afghanistan, and Myanmar. She represents HI in the Disability Inclusive DRR network and advocacy-based network in Asia. Thank you so much, everyone, once again for joining us. And over to you, Annie.
Thank you, Michelle. Thank you so much, Michelle. A very warm welcome to the audience who have signed in from India, Sri Lanka, Bangladesh, and Nepal. A very warm welcome to all our panelists. We have an excellent panel today representing organizations that not only work across the South Asia region, each of the panelists will bring in their unique experience and expertise on climate change and the impacts that climate change has on different people, different groups of people and communities. So on this panel, we have Mr. Saicom Kennedy, who is the Senior Manager Operations from Sphere India. We have Professor Asha Hans, Executive Vice President from Shanta Memorial Rehabilitation Center. We have Ms. Aditi Ghosh, who is the Country Director for Sri Lanka Child Fund International. Ms. Veena Bandyopadhyay from UNICEF. Mr. Shailendra Yashwant, Senior Advisor Communication and Advocacy for Cancer. And Mr. Shubham Tandon, Project Officer Resilience with UNDP. We may also have Vikrant Mahajan, CEO of Sphere India, joining in briefly, but as he's traveling, maybe he may not be able to join. I would just put in a little word of advice for all my panelists. Please speak slowly so that our sign language interpreter can follow it at the pace at which you're speaking. I would like to start with Kennedy. Saicom Kennedy is a humanitarian and development professional with over 11 years of experience. He has played a very important role in strengthening interagency coordination by developing strategic partnership with state governments, with humanitarian agencies, with CBOs in different states across India. And he's led interagency coordination for more than 15 emergencies in India. Notably, he is globally accredited as a certified trainer of trainers on disability, age and disability inclusion and humanitarian action and standards. So, Kennedy, could you please share with us your insights on climate-induced disasters in South Asia and how these are influencing the region's environmental landscape, and also the impact of climate-induced disasters on socially marginalized communities and the consequences on their well-being. So over to you, Kennedy.
Good afternoon. Good evening, everyone, and thanks, Annie. Michelle, will you please put up that PPT? So today, mostly the session topic is on this promoting inclusive climate actions and resilient building in South Asia. So first of just as a part of the context here, things like I'd like to share some of the thoughts here. Yeah, Michelle, can you please come to the next slides? Yeah, you can just put up. So this is the global climate risk index ranking for the South Asians, and uh, recent report of this intergovernmental panel on climate change also emphasizes that there will be an increase on these extreme weather events in India in the coming years, and most of these climate-induced disasters. Yeah, there is no boundaries, and when we say these climate-induced disasters, they are not they really doesn't discriminate. So they cause the impact beyond boundaries, and this is the global Rex index here. Please the next slides. So this is some of the recent events on the climate-induced disasters. When we are experiencing floods in Pakistan, in India, in Uttarakhand, then we have this cyclone Mosas in Myanmar, and heavy rainfalls and landslides in Nepal, and this cyclone Barparjoy in India. There are, as per the World Bank reports, like into 2023, like in the Southeast Asia regions, it has also face one of the severe heat waves. Yeah, can you come to the next slides? So this is some of the past impact due to the climate change. So like between this 1990 and 2018, like more than 750 millions, 50% of the South Asia populations were being affected by the climate-induced disasters, and more than 50% are accountable to floods. And drought hit the greatest number of the peoples, more than 50% of the total disaster affected populations. And India has the biggest share of this damage. Yeah, next slides. So these are some of the projected impacts of climate change. Can you come to the next slides? So when we look to the most marginalized and the vulnerable group, like the climate-induced disaster always disappropriately, like causes impact to the peoples, especially to the marginalized group. So when we talk about the marginalized and the most vulnerable group, there are elderly peoples and the children, women, differently able peoples, the indigenous group, and rural communities and farmers, the migrants, and those marginalized groups staying in the coastal communities, they are more vulnerable. So this is some of the vulnerabilities mapping which we have done it. So like elderly people are vulnerable with heat risks in heat, then limited evacuations during disaster, access to district healthcare, social isolations worsens, then children face this disaster risks for yeah, disease risk-borne disaster, education disruptions, long-term impact, psychosocial trauma from events, and nutritional challenges, and food storage, limited adaptive capacities. Yeah. Michelle, next slides. Also, these are some of the vulnerabilities for the women and people with disabilities. So when we look to the people with disabilities, we have come up with this limited evacuation options and communication barriers, intensifies and inaccessible to, refuse facilities, and medical support challenges increase. This hinder mobilities during disaster, and assistance and accessibilities, mental health and challenges escalation. So what we need to, like, what actually what I'm trying to put up here is, like, in this we need to understand the this intersectionalities point of intersectionality points of impact, like the advanced impact of this disaster and climate change on individuals with multiple vulnerability factors. Like, if we see earlier, I put up some of the like the vulnerability mapping profiles, like including these women, girls with disabilities. They require adequate measures they take into accounts of their respective requirements. So there is always this in addition to this deprived as a person with disabilities like access to resources are even more poor for those belongings to this other marginalized group. There are a lot of examples. I think there will be a lot of good examples. I think we will be hearing from the other panels. Yeah, Mission, can you just move into the next slides? So these are some of the indigenous vulnerabilities and vulnerabilities of the coastal communities. Yeah. Michelle, can you just come to the next slides? So like so people with disabilities has been disproportionately affected by this climate-induced disaster, and most of them are unique in the way where they are differently able and need of assistance are quite unique at the times of emergency. Even when they are migrating from one place to place, or at the times of assisting to humanitarian assistance, and at the times of recovery phase and others. So if we look forward, even the 2030, this agenda for sustainable development goals, and the conventions on the right of persons with disabilities and Sendai framework for disaster risk reductions, this really guide the government toward disability inclusive sustainable developments to support the twin track approach. And one of the these recent developments and learning for the humanitarian network is, we call it the cluster approach, but we call it also the sector coordination. So this also really strengthens the coordinations within the sectors, between the sectors on the humanitarian assistance, by clearly also defining the role and responsibilities during the crisis. So this is some of the sharing, and to make it more diverse, and we should always encourage the active and the free, meaningful participations and inclusions of this person with disabilities, and the diverse representative organizations at all levels and decision makings and actions on climate resilience, so that any of our humanitarian actions is inclusive and also is complementing and supplementing the government effort also in meeting the global indicators. So yeah, this is all some of the sharing from my ends. We look forward to listening to the other panels in this discussion. Yeah, thank you. Over to you. Yeah.
Thank you, Kennedy. Thank you, Kennedy. Basically, moving on from here and building on what Kennedy has just presented, I would like to share, as a representative of HI, a study that we have done together with the National Disability Federation in Nepal. It's a study that's based in Nepal, and this is specifically on disability. So I will share my screen, if you can allow me a minute. Is my screen visible?
Yes.
Okay, thank you. Right. So, on behalf of HI and the National Federation of the Disabled, Nepal, I would like to present the findings of a research that we recently concluded on persons with disabilities and the impact of climate change on people with disabilities in Nepal. And this report is basically an effort to highlight the disproportionate effects of climate change on persons with disabilities through an in-depth look at the situation in Nepal. And before I dive into the study itself, let me share with you the rationale behind commissioning the study. So it's increasingly apparent that climate change is widespread, rapid, and intensifying, and the irreversible impacts that it is making and affecting every region in the earth and in multiple ways. And the negative impacts of climate change tend to be more felt and more intensely by people from marginalized groups, poorer communities who face underlying structural inequality. And when we look at disability, the prevalence of disability, most of you must be aware that it's often said that the world population, 15% of the world population has a disability, which means this we're talking about 1 billion people. And of this 1 billion, 80% of them live in the global south. However, there is significant lack of knowledge, evidence, and that could support advocacy. The context in Nepal is quite interesting. Like many other countries in the region, Nepal is already facing devastating climate change impacts that are threatening its long-term development. At the same time, Nepal has put in place some very overarching climate change policy framework quite early on. They have dedicated policies and plans as well as sectoral planning processes which integrate climate resilience. Nepal also has made notable efforts regarding adaptation initiatives that are inclusive of local communities, which makes this context a bit interesting. When we look at the research, what did this research look at? This research intended to understand how persons with disabilities understand and perceive climate change. What is their experience of dealing with the climate extremes? What are the impact on their health, livelihood, and support system? And what is the actual level of inclusion in climate adaptation planning? In terms of methodology, HI surveyed 380 persons with disabilities across 7 provinces in Nepal. We consulted 20 key informants from disability movement, from government institutions, aid sector. We conducted 8 targeted focus group discussions to hear the voices from women, youth, and different impairment types. And you will find from this slide that the respondents cover a diverse group based on their gender, their urban or rural, their caste, ethnicity, impairment types. And of course, if you want more details, you can look at the report and I will share it in the chat after this presentation. I will quickly move to the key findings and discussion because of the limited time available. So what we will present is very, very key points from this report. And these are structured around 4 thematic areas. The first area is the perception of persons with disabilities about climate change. The specific challenges that people with disabilities face in situations of climate-related shocks and stresses. The impacts on their livelihood and their participation in climate governance at different levels. When we look at the findings around general perceptions and understanding on climate change, the study suggests that respondents are increasingly aware of the concept of climate change because daily they have observations, they're directly experiencing major disruptions. So 60% said that they are aware. But they also mentioned that climate change is a little more complex and difficult to fully understand all its elements. Most respondents shared that there is a significant information gap regarding climate change, and that is preventing them from identifying and adopting adaptation strategies and behaviors both at an individual and at the household level. The study further highlights that people with disabilities in climate-related disasters face some specific and unique challenges, and we're just sharing 2 examples of this. There is a lack of timely and inclusive early warning information that hampers their capacity to adopt protective measures. So you can see that 85% of the respondents said that they did not receive early warning in their community. There is a lack of accessible, safe shelters, making it difficult to evacuate due to logistical, transportation, and safety concerns. And again, you can see the data out there is overwhelming. 87% say that they stay at home in case of disasters. Respondents also spoke about climate shocks and stresses that exacerbate their already higher risk care needs. They face difficulties in accessing emergency health services. They face the risk of losing essential medical equipment, being cut off from their caregiver, primary caregiver, who is extremely necessary for their well-being. And heat waves are of particular concern for people with disabilities, chronic illness, older persons, and persons with psychosocial disabilities. In terms of livelihood impacts, the study has shown a high unemployment rates. Because of high unemployment rates, threatened rural livelihoods, decreasing intergenerational support and care due to migration, and difficulties to navigate and access social protection services, it makes it more difficult for people with disabilities to build economic resilience. And we know in Nepal, the hilly areas, and these are further marked by further geographic and social and economic isolation. Excuse me. The research has also showed us clear gaps and omissions in terms of inclusion of people with disabilities in local climate governance, with the vast majority reporting that they have never participated in climate discussions or climate decision-making processes in the community. There are certain examples of strengthening disability inclusion in these processes. However, these are fairly anecdotal. A limited number of disability activists do get involved in climate policy making and planning, but majority, and most of them are willing, but majority feel that the issue is large and feel overwhelmed to fully grasp all the elements of it. And there are also lack of opportunities offered from the public structures to participate meaningfully. So these inclusion gaps are usually the result of inadequate policies with regard to specific needs, lack of capacity of service providers, there is insufficient participative processes and decision-making, there could be insufficient funding levels, there's lack of data to assess the situation for people with disabilities, and lack of individual opportunities for people with disabilities. And very broadly, general inclusion framework to address these gaps are around 4 major areas. That is, promoting full and meaningful participation in decision-making, that is within the principle of leave no one behind. Acknowledge the diversity of disability. Empower persons with disabilities and support them to develop their capacities. And remove barriers so that nobody is left out. So basically, any approach requires a more comprehensive approach to inclusion, and using this framework would strengthen disability inclusion in climate action. And based on these findings that are presented above, the report further provides key recommendations for institutional stakeholders, for NGOs, for INGOs, organizations of persons with disabilities, and the donor community in Nepal. So if you are interested more in the, so I will not be presenting all the recommendations here because those are more relevant to the Nepal context. Of course, a lot of it could be also used for this place. And we would, if you're interested in details of the report, again, I will share it in the chat after this presentation. And with this, I close my presentation and thank you for your patient listening. I will now stop sharing my screen. And have I stopped sharing my screen, Michelle?
It's still visible.
Okay. How do I stop?
It's right now.
It stopped?
Yes, it has stopped.
Okay, thank you. So it now gives me immense pleasure to invite Dr. Asha Hans. Dr. Asha Hans is the founder and executive vice president of Shanta Memorial Rehabilitation Center. Shanta Memorial Rehabilitation Center is an advisory member of the UNFCCC. She's a former founder director for women's studies and professor of political science in Utkal University. Dr. Asha Hans is also on the board of the UN Women's Peace and Humanitarian Fund. Her work focuses on gender related to women with disabilities and issues of conflict, disaster, and climate change. She has extensive experience of working on national and international research, and her research has helped government also bring out the national guideline on disability inclusive disaster management. She has written extensively on gender and climate change in her latest book on engendering climate change, learning from South Asia. I invite Professor Asha Hans to please take the floor. Tell us about how gendered impacts on climate change and the importance of ensuring participation of women. Over to you, Asha Didi.
Thank you, Annie. It's always a pleasure to be on an HI and Sphere program. And I thank for you both for inviting me and letting me part of this today's immensely important seminar. When I speak too fast, let me know, Sana. I have a habit. Now, I will speak on gender inclusive climate change, basically through my own research over 3 areas that I have done from the last 10 years, maybe. And these are 3 cases. I will look at women with disabilities, and from there go up to down to just women. And from 2 areas, one is coastal erosion, and the second is from heat. Now, we all know this. These are the pictures of where I have worked in the last couple of years on the east coast of Orissa in India. And you can see that the sea is creeping in very, very rapidly. Most of the sea coast in Orissa is now under this deep erosion. And where these disasters, these are the areas where I have worked. This is the East Coast with 5 districts which are most hit by coastal erosion. And among them, one of them, for example, where Sadbhaya is concerned, is where the villages are fast disappearing. As far as I know, 11 have disappeared. And we know that it is climate change because disasters are intensifying in this area. There are storm surges, sea level rise. When you talk to the farmer, they'll tell you there is rain variability. The water, I even 20 years ago, the wells were all salinated, so they're getting much more. The loss of agriculture, last that I looked at, some of the data was nearly 6,000 hectares of land has been lost in this area. Fisheries will become less, not because of that the fishing, though they are going into the deep seas, but because the quality of fish has gone down. The beautiful, good fish that we used to be there, no longer there. There is a lot of displacement, multiple displacement. When I used to work on displacement, and in Hirakud, twice displaced, and we used to say, oh God, they've moved twice. If you look at this now, they have moved from 5 to 9 places at least. So displacement, most of this, as we know, as you see at the bottom of the map, that these are anthropogenic impacts of human influence. You have the Dhamra port coming up, the Wheelers Island, where all the missiles are being tested. So this is Sadbhaya, where we did our field study, which we are doing now with women with disability. We know that the impact of where women are concerned, patriarchy is very strong everywhere, but it is stronger, we found, in these coastal regions. Poverty is higher. Livelihood is barely minimum. There is very little livelihood. And there's extremely high violence. And this the loss of violence should not have been there. Very, very high violence against women that are there, much higher even among women with disabilities. And there is lower decision making, especially because they're not even asked to join in the adaptation in any decision making. And that is not only here. The national level shows you that about the last I saw was 2 to 13% of women joint decision making. So the most important for us in this area that I have studied is our adaptation because climate change intensifies gender inequalities. The ownership of assets that are there are never divided equally and much less for women. And these can be overcome with thought through new adaptive strategies, especially built on women's collectives. These are some of the adaptations that have been looked at, and they have been found to be, some have succeeded. You'll see the cyclone shelter, it looks as if it's accessible, but it is not. These are the other adaptations, the kitchen gardens. This is a relocation colony. In fact, Odisha has one of the first relocation colonies ever thought of in climate change. And that was done in the 1970s when people from Satbhaya began to be displaced. These are one of the major adaptation in this, that we did a study on climate change and migration, was of people migrating from this region because of climate change. Now, the problem is that women don't migrate. It is all male-led migration. In the last 2 years, we have been seeing more and more women go. But on the whole, it's all male-led migration. So what happens? What happens is that when men go out, there are women-headed households left. So there is more women are left behind. They're divided into two parts. One part where women get remittances, so they have food security, they are much better off. On the other, women-headed household which do not get remittances, you will see huge food insecurity, to the extent that women there would have only one meal a day. 45% have widow pension, and widow pension is 300 rupees, that's it. So remittances play a very important role, but they are usually not, it's erratic. It's there today, it's not there. The last I was in Kendrapada, 2 bus loads going to Kerala every week of migrants. So you can imagine the number of women-headed households there. The violence increases. In fact, one woman said, I'm glad he's gone on and he's migrating because the violence will be less at home. So, but there are lots of gender roles. Women sometimes, usually now, don't bring in water, which they used to earlier, where water was scarce. They go ahead and let the men do it and bring them on bicycles, on trucks, whatever it is. And the corporate market has caught on. So water has become scarce, but water has also become something that is sold on the market. The most impacted, as I said earlier, and which Annie and Kennedy both said, are women with disabilities. These are the women with disabilities we are working with in Kendrapada course. They are vulnerable largely due to the inequalities already existing, and they are not part of any adaptation and mitigation. In fact, we had to look for 150 women with disabilities. It was so difficult getting them because they are so invisibilized. The use of climate justice paradigm is not recognized where they are concerned, and therefore they do not get the human rights and development rights that are supposed to be there. States, if they do not comply with the Paris Agreement where women with disabilities or women are concerned, mean that that there is something, it is, you can say, much more than even overlooking human rights. The third, I did 2 coastal erosion. The third is a study on heat. Both of my previous speakers spoke on heat, and this is the data that has come from a study recently done on South Asia, which includes Nepal and which includes India and Pakistan. The increasing heat leads to where intimate partner violence is concerned, 1 degree leads to 6.3 increase in violence. The study covered 194,871 girls between the age of 15 to 40, and they found that physical violence was highest, 28.3, sexual came next, 26.1. but emotional was 8.9. But my own work on the course shows that emotional is much, much higher. I think there is a differentiation in which we see it. Maybe coastal erosion, there's much more than where heat is concerned. And they said that by 2090s, India will even go higher than, much, much more higher than what it is. I don't know why Pakistan is low. I still have not figured that out, but the study is just out, but maybe you can have a look at it. There was another discussion that was done by the State Commission for Women in Uttar Pradesh, where she said that it is true when there is heat, farmers don't have work, they stay at home, and that is what we have started to call the COVID effect. Domestic violence goes up. But on the whole, as workers on climate change, we see that there is very limited information on heat risk at the village level. Whatever they do is basically what they have learned from childhood. There are strained health infrastructure. When it is too hot, the hospitals are full. And there is also, can I come to the COP messages later, or do we do them now? Annie?
Later.
Okay.
Later.
So I finished my presentation with this, and I hope that we'll be able to discuss some of the things that we have seen where women with disability are concerned. And thank you so much for inviting me, and I look forward to a good discussion.
Thank you. Thank you so much, Dr. Ashant. So up till now, we've been discussing very broadly about climate change and their negative impacts on women, on people with disabilities. We will now move to a different, we will now hear about some examples of how inclusive approaches have been used to respond to climate-induced disaster. And to speak about this, it gives me immense pleasure to introduce and invite Ms. Aditi Ghosh. Aditi has over 15 years of experience as a senior leadership and management roles in diverse humanitarian and development contexts in Asia Pacific, Africa, and Middle East. She's held several leadership positions spearheaded development of organizational strategies, systems, and capacity. Aditi is presently working as the country director for Sri Lanka for Child Fund International. She has worked with Humanity and Inclusion, CARE, with Dan Church Aid, Red Cross, and IPPF, leading national and regional global humanitarian program operations. She's an avid traveler, a voracious reader, and causes such as gender, inclusion, and climate justice are very close to her heart. Aditi, over to you to share about your experience and your work on intersectionality and anticipatory action.
Thank you, Annie. Thank you so much. And thanks, Sphere and Humanity to Inclusion, for bringing this topic. When the world is gearing up for COP28 in Dubai, many decision makers, practitioners, and climate advocates is going to discuss this. I think this is the right moment to also bring not only the climate change discussion, but the inclusion in the climate change issues on the forefront. We had some kind of examples from India, Pakistan, and Nepal. The Kennedy started with the Global Climate Risk Index, and you have seen that how vulnerable South Asia are. All the countries are within the first 50 on this climate risk index. South Asia is home to over 600 million children and has the highest number of young people globally. I need not to say again, I think which is already established, how vulnerable it is on the climate change, and more than half of the regional population every year face the multiple climate-related events, and which make poor the poorer, and it's really put marginalized populations into a cycle of poverty. And we also, I think all of us is experiencing the rising in global temperature, changing weather pattern, I'm from Sri Lanka, and this time general west coast of Sri Lanka should be dry, but it's raining every day and it's getting flooded. So you can see that how the climate change impacting each of us on our everyday life in the, I think, all the country in the South Asia. Specifically bringing the focus to the children and their families, I just added a quote. This is the UNICEF published recently a declaration for the children, by the children, on the climate change and how it is impacting on them in Sri Lanka. So I think that's the children feel that their life is impacted, because when their caregiver, their parents are, that their well-being is impacted, so their well-being is also automatically get impacted. And we also know that all disasters, all of us who worked in humanitarian crisis have seen the school become the evacuation center, and how the first thing which is get closed is the school. So the children probably get directly impacted by the impact of climate change and the crisis. And of course, Child Fund is an development organization working on the well-being of the children. So inclusive climate actions and DRR program is one of our focus. I'm not going here to explain about Child Fund and the Child Fund program, but just wanted to say this is something is very close to our heart. I have been asked to speak a little bit of on the anticipatory action, and I thought let's bring your attention to the small, beautiful little country on the south of India, Sri Lanka. This is an anticipatory action example from Sri Lanka. But before I go there, like just for unversed, what is anticipatory action? Generally, what happened traditionally when there is a crisis, then there are forecasts, then there are warning, then the disaster event happens, and then the response. So that was the usual practice. With the time, it is evolving. It has been proven that if we actually intervene before the crisis gone into a peak, it is much more dignified and it is much more cost-effective intervention. So when I say the anticipatory action, it is the based on the early warning and forecast, we take action to protect lives and livelihood before the big disaster event has occurred. And of course, we need pre-arranged financing, because when there is a disaster happen, for the response, probably it is relatively easier to get financing. But in anticipation, without pre-arranged financing, we cannot do an anticipatory action. So this is the look like that we get, let's say, flood, we get the forecast, where, when, and then the flood goes to the peak, and then we start responding, then the response come up. But here we are anticipatory action we are talking of, we are doing before flood going to the peak. This anticipatory action is happening. So it's happened before response. And in a flood, we get 5 to 10 days lead time usually, and where and how it is going to impact. And that's where our opportunity to intervene early, which is not only cost effective, it is I'll just share an example from Sri Lanka. We found is more dignified way of implementing action. So this is the example I wanted to share. This is worked in a consortium of a few organizations here in Sri Lanka, including Humanity and Inclusion. This was in 2002, before Southwest monsoon. And these are the areas where the anticipatory action was happening. Some of these areas are frequently flooded every year during the monsoon season. So when last year the rainfall was increasing and there is a flood is going to happen predicted within next 7 to 10 days, with this START network funding, 4 of the organizations came together for implementation of this anticipatory action. So it was implemented in Goal, Colombo, Gampaha, Kalutara, Kegali, and Matara and Ratnapura. That's the geography I have seen, which is actually get extremely flooded during southwest monsoon. So the main idea was that how we can support government and communities so that they are better prepared to face the flooding which is going to hit us in 5 to 7 days time. How to bolster the capacities of the government, equip community also to face this. So we had the mainly 3 activities implemented through which we reached that 4,400 household through cash for work. In this cash for work before the flood, you can see in the picture, we started cleaning the canals so that water can flow, the impact of flood can be reduced in the area. We have equipped 28 safety centers. So those safety centers are equipped with the food, basic health and hygiene material, so that community can move to those shelter when the flood is, before the flood is going to hit them, and be there for at least 7 to 10 days during the peak flooding hours, and community know where this is. And third is that the district disaster management center, we also provided them support so that they can effectively respond to the community. And this was various kind of equipment so that they can do the early warning announcement, they can rescue people. So all those equipment was given to district disaster management center. Now, why we are talking of inclusion, and where was the inclusion in the whole response? I think the interesting part in this response was bringing all the inclusion, but specifically the disability inclusion component to that. So when we discuss for cash for work, I remember there was a lot of discussion, cash for work, first of all, identify in your beneficiary or the participant list, do we know how many person with disability is there, what data is available? We did found there's a lot of data gaps. Some of the information was available in the community, but not with the government. So that's the first thing. Know that they do exist and look for them. The second one is that when we plan the intervention, there's a lot of deliberation. Okay, cash for work, how then we include the person with disabilities in the cash for work? And then they said, we cannot include them in this work, that work. What the base learning I learned from this intervention is that do not assume. Just ask them that these are the activities we are planning, which one you will feel comfortable to participate, which one will be difficult for you, instead of just thinking, they may not be able to do that, let's think for some other work or easy work so-called for them. That's not the true. I think they have their own capacities, and like it's the best and simple way, just ask them what activities will be easier for them. Second, on the safety centers, when we did that, how we ensure that person with various kind of disability can access those safety centers, and what are their specific needs, and how we ensure when we are equipping the safety centers, we take care of their specific needs as well. So that's where bringing the inclusive component. And third, when we work with the district disaster management center, I think doing a lot of awareness on them, that making it inclusive, understanding the person with disability, their specific need during the whole response process. So that was the inclusive approach. And at the end, we really found it is more dignified way of providing humanitarian assistance, and it was also very cost effective. That brings into me the overall discussion of the intersectionality. With my long experience on working humanitarian response, we do understand that there are people of various gender, various religion, socioeconomic status, disabilities, sex, gender. But actually, when we plan an action, how much we include them into the planning, that's probably a question we need to ask, and how much we are aware about their needs and how we know include them into this process. So each one of us have a multiple identity. I'm a woman of this age, from this socioeconomic status, and this multiple identity of us put us in various uh, position in terms of power in the society. So that brings to the next one, let's say age, gender, disability, the marital status, sexual orientation, religion, HIV status. You can name 20 other things which is not in the circle. That is actually work in power relationship of the household and communities. And I just put a picture, and that's generally when you have a discussion with that picture and see what do you see in this picture. And many cases people miss that also there is a person with disability in this picture. So just same as a community, when you work with the community, understanding the diversity is the community, and if you don't see this diversity, then probably you need to go a little deeper to find that, but that do exist in every community, everywhere we work. So thinking of the intersectionality, when we also thinking of climate action, that's probably, otherwise we will be again struggling to meet our SDG goal 2030 if we are not inclusive in our action. So as short, I wanted to say that both as a humanitarian actors and development actors, we need to have the understandings of what are those diversities, what are the equity, what are the accessibility requirement, what are the inclusion. I think that understanding is needed, not only intellectual level or discussing this kind of webinar, is to the practitioners, to the volunteers at the last mile who are actually interacting and working with the community. And the second, and that's the most important lesson I have learned, that ask them, if you are working with a person with disability, ask them what is their requirement. If you are working with the LGBTQI community, ask them what they require, don't assume. And the lead by example, like we, of course, are we walking the talk? How much we are kind of diverse as a team. For example, a team who are doing the response, how much diverse that team is that. And even there is a diversity of the team, how the organization environment encourage people to share freely their diverse opinion. Those are more important. What is the accessibility? The accessibility, the webinar we are presenting is that webinar, and when we're discussing about disability, other person with various kind of disability able to listen it, learn from it. Of course, we have a sign language, and also now all Word, Excel, everything has accessibility features. When we create document, share document, how much accessible we are, our office environment, how much accessible we are, those kind of questions probably need to lead by examples. And the language matter. And when it comes to a specifically person with disability, I think that's matter a lot. How we address a person, that's matter. For example, we say that Sarah is blind. Vis-a-vis, I say that Sarah is a teacher who has a disability. Does this two sentence sounds different to you? I'm sure it is. So that's why the language matters, and we all work in development and humanitarian sector need to be aware of these languages. And I always say that disability etiquette, we should also learn those etiquette when we speak with community or in a various forum. So that's in short I wanted to share, but I just want you, instead of just saying thank you, ask you to think what's next in your program, in your action, in your organization, in your community, how you could be more inclusive in your work and in your workplace. So with that thought, thank you very much.
Thank you so much, Aditi, for for sharing your insights and for your very specific and practical oriented suggestions. And this takes us to yet another inspiring and dynamic speaker panelist, and to a different topic, which is around social protection. So it's my pleasure to invite Ms. Veena Bandyopadhyay from UNICEF New Delhi. She is the social protection specialist. She leads several multi-state initiatives has an extensive focus on gender transformative and shock responsive social protection agenda and cash plus approaches. She has over 30 years of experience working with United Nations, international organizations, bilateral cooperation in the areas of social policy, planning, and advocacy. She brings to this panel her deep understanding of issues of poverty, gender, gender rights, social exclusion in the areas of policy analysis, advocacy, strategic communication, and system development, and data analysis and research. So over to you, Ms. Veena.
Veena has requested us to move on to the next speaker. She'll be able to join us in 5 minutes.
Okay. Okay. So we'll move to Shailendra Yashwant. So Shailendra is here, right? Michelle?
Yes.
I'll just come in for a bit. Veena ma'am is just away for 2 minutes.
Okay.
Okay. Thank you so much.
Thank you. So Michelle, do we move to the next speaker or do we wait for Veena ma'am?
Yeah, we can wait for Veena in that case.
Meanwhile, if the participants, if you have any questions, you can put it in your chat for all the speakers, for all of us, and we will take it up in the Q&A session after all the panelists have finished speaking. Michelle, should we move to Shailendra then?
Sure. Since we are running a bit late,
Yeah.
maybe we can move on to Shailendra.
Okay. So I'd like to invite our next panelist, Mr. Shailendra Yashwant. He comes with quite an interesting profile. He's an independent environmental journalist, a documentary photographer, and a campaigns consultant based in India. He's a senior advisor, communication and
Yashwantji, I'm back. I'm okay to go last, but I'm back just to inform you. Okay.
Okay. Thank you, Veena ji. Maybe we'll go with Yashwant ji and then we'll come back to you.
Yes, it was call which I could not ignore. Sorry about that.
That's okay. Thank you for informing us. Mr. Shailendra is the Senior Advisor Communication and Advocacy at Climate Action Network South Asia. He's also the steering committee member for Pesticide Action Network India. He has served as the campaign director for Greenpeace in India and Southeast Asia. Shailendra Yashwant will highlight the opportunities and importance of collaboration and networking, and especially of his experiences on cross-learning to promote inclusive climate action in South Asia. Shailendra, over to you.
Thank you so much, Annie. I'm really want to thank all the panelists preceding me for their very inspiring and insightful interventions. And thanks to all the good folks at Sphere India for inviting me to this important conversation today. I've learned so much. And I am genuinely in awe of the work that you all are doing out there to build more resilient communities. Yeah, I must at the same time also say that I despair thinking about how much more needs to be done if humanity has to survive the ravages of climate change. I mean, make no mistake, we are in uncharted territory. This is I'm going to share my screen. This is the warmest uh, the planet has been in last 10,000 years. You know, all the climate disasters that you're talking about, that you're dealing with, are a result of the planet warming by 1.1 degrees Celsius in last few decades. Now imagine the impact of crossing 1.5 degrees Celsius threshold. Why imagine? I mean, it is just a matter of time, and you will soon be all running around like headless chicken, all of us chickens, as we have crossed 1.5 degrees Celsius many times already this year. And worse, we have breached the 2 degrees Celsius mark twice last week. I had that graph to show, but somehow I can't share my screen last week. And we know what that is going to mean. I'm going to actually, Annie, looking at the audience and looking at, and acknowledging the presence of regional players here, I'm going to actually talk about my pet, solution to the problems that we are facing. Something that at Climate Action Network South Asia, we believe strongly enough to design our activities around regional cooperation. We all know that, climate change knows no borders, neither does air pollution, nor does groundwater depletion. So the call for revival that we saw, I think it was at the last COP in Sharm el-Sheikh, for SARC countries to come back together on climate action, especially in the areas of disaster risk reduction and climate change adaptation, are critical. I mean, the work that was shared from Sri Lanka, what our first speaker shared and everything, I mean, everything that you're doing is regionally, and in a conversation earlier, we did talk about how these solutions remain in certain islands. I think Veena was going to touch upon that. How do we talk about inclusive action? How do we talk about the frontline communities without acknowledging that that climate change knows no borders? We know that the region has a history of several large projects executed by intergovernmental and civil society institutions like ICHIMOD, International Center for Integrated Mountain Development, Asian Development Bank. We know that the South Asia Hydromet Forum, many of the participants here have been involved in the regional initiative that was launched by World Bank and brought 8 South Asian countries together to modernize hydromet services, improve knowledge sharing and capacity building. There is also the Green Grids initiative, the One World, One Grid, One Sun, One World, One Grid initiative that imagines, renewable energy from solar, wind, and water flowing across the region, across countries and communities. Clearly, I mean, to tackle the unfolding climate and economic emergencies that impact the shared future of 8 nations, maybe it is time for all of us to think together as to how do we all come together in the region to tackle this crisis together, to share our best practices across national borders. I mean, what happens in, air pollution, for instance, in Delhi is affecting Lahore, is affecting Kathmandu. Yeah, if we were to look for solutions like the ASEAN countries are working on, we have to find solutions together, whether it is heat waves, air pollution, floods. Currently, as we all know, SARC is defunct, but let's not forget that, it started with a 3-year SARC action plan on climate change in 2008. that had identified 7 thematic areas of cooperation, which led to the Dhaka Declaration on Climate Change, where, mind you, that was the first time where governments from this region stressed that climate change is substantively the result of greenhouse gas emissions by the developed world for over 2 centuries and called for international financial support. This demand is what evolved into the strident call for loss and damage fund, the reparations and compensations that the civil society and poor and developing countries have been bringing to COP for over 30 years. But together, we were able to get that big victory, if you like, for civil society and for poor countries, for the setting up of the loss and damage fund. The last we heard from SARC was the Thimphu statement of climate change for regional cooperation. Unfortunately, since the last summit in 2014, SARC is yet to reconvene. And that's where we come in. That's where people come in. That's where civil society comes in. That's where all of us who are working with frontline communities come in. I'll give you, before I close, I just want to share an example of what people-to-people cooperation could, look like. In the last few weeks of June 2019, a series of WhatsApp messages were sent from Bhutan to India to warn cross-border friends, if you like, downstream of Ai, Saralbhanga, and Manas rivers, about cloudbursts upstream, swollen rivers, and possible flash floods affecting people in the Indian state of Assam in Bodoland, where I was actually documenting this great work being done by Oxfam on transboundary cooperation on rivers. Yeah. Now, those WhatsApp messages that were coming between friends is what saves lives. Because although, these messages came from official channels in Bhutan, they were not sent to the downstream people in Bodoland in Assam via official channels. They came through unofficial channels, because official channel would involve the local administrative head of Dzongkha or district in Gelifu passing information to officials in Bhutan's Thimphu, then who would then inform officials in New Delhi, who would then inform officials in Guwahati, and then the message will somehow reach Kokrajhar, which is the district headquarters of the place that I'm talking about. In most cases, the circuitous channel would take too long, but with, and that delayed information could cost lives. This people-to-people cooperation, to me, where people are, and in the times of climate crisis, is a perfect example of why we should be talking about taking actions together, why we should be thinking regionally, why we should be acting together. I'm going to stop here and I'll come back, Aditi. I'm keeping in mind the time, Annie, and come back on the COP28 intervention later. Thank you so much.
Thank you. Thank you so much, Shailendra. So we move back to Veena now. Veena, I already introduced you just previously.
Yes.
So if you can come in, it'll be great if you can share the case studies and best practices that highlight the role of shock responsive social protection in reducing protection gaps and addressing climate and disaster risk. Over to you.
I have sent my PPT. Let me know how if I can share. Can you see my screen? I don't think.
Yes.
Yes, Veena.
You can? Can
Yeah.
you? It's
Yeah,
calendar
but
right now. Okay,
yeah,
no,
yeah.
I'll open the PPT. Okay, so let me just go. So, okay. So first of all, I would like to thank you, Sphere Network and Annie for hosting this and inviting me on this panel. And really learned a lot from all previous panelists. And I am not so sure whether I will be able to address all the expectation that was set out for me from this presentation, but I would try my best and will share the material which can help you understand various good practices globally and in the region. But given the brief time, whatever best I can mention, I will. So before, as many of you have already said, and given that very learned people who are working on social protection are on the panel, so I don't need to go into very much in detail, but just to set the context in terms of social protection, which is very loosely used by many stakeholder, and social protection sometimes is also confused with social security and others. So the common definition as interagency group uses for social protection is set of policies and program that aims preventing and protecting all people from poverty, vulnerability, and social exclusion. What it consists is contributory social insurance and non-contributory social assistance, transfer, cash and kind, and social care services, and labor market intervention. Where social security, which is cash transfer, becomes a small part of the whole thing. And many times I've seen stakeholders do confuse between social protection and social security. Going further, the three aspects of social protection, which why it is has become very important. I have highlighted three areas and three work. One is social protection system, which is definitely has a high potential as a policy instrument to address covariate shocks and is critical policy tool. Second is social assistance, because even if everyone has rights and entitlement, uh, people vary due to their caste, class, gender, disability status, where they are, and henceforth, even if you have one has right to all entitlement, still poorest of the poor do require certain kind of transfer, cash in kind in difficult situation, including disaster. So social security becomes very central to social protection system when it comes to leaving no one behind and last mile. Number of ways that we see as disaster risk management and social protection actors can improve the system is bringing social protection at the center stage of poverty reduction, where the social protection is one of the critical strategy, and linking with disaster risk plan. The second one, leaving no one behind approach, which we say as cash plus, including and providing ensuring access to all welfare services, developing anticipatory climate resilient and policy system, which is backed by fiscal and public policy approaches. Social registry, which is still in India and many middle income country, is very new and work in progress. A social registry also, because of the conditional cash transfer, does not provide entitlement to many, and large number of poor are out of the social protection system. Local community is and all that is mentioned. So I will not go into detail why social protection is very important. Many of you have already mentioned. Coming to UNICEF's approach to social protection, this is a conceptual framework within which we work. So which highlights two aspects. So social economic vulnerabilities of family and children living with is the common factor to poverty and vulnerability. And the social economic, both the vulnerabilities are pushed and heightened when they are faced with disaster or shock due to price rise, due to war and conflict, due to other risks. So those are the vulnerabilities that gets enhanced. So protect, prevent, promote, and transform are the four approaches through which we work. To cut all that in short, three intersectionality of shock responsive social protection that we highlight and we talk. One is about social protection as a whole, which is for everyone. All citizens are expected to receive or receiving some kind of social protection entitlement, that starts old age pension to a child benefit grant or a scholarship or various food subsidies, etc. The other is which is humanitarian cash transfer, where disaster risk reduction mostly characterized by addressing vulnerabilities where specific communities are targeted, and then to climate change adaptation, and there is a social protection program designed to reduce the risk on that front. So because UNICEF works on children and they are our priority, we see and uh, traditionally children have never been recognized as a critical constituency who get impacted with disaster or emergencies, as they are seen as parent, their custodian. COVID-19 has exposed this reality and has forced all the policymakers and implementers to recheck, and it has impacted children to a great deal in terms of number of dropouts and those children that never come back who have dropped out from school, their potential vulnerability to marriage, to trafficking, to negative coping mechanism, and including many other things, which is categorized as a physical, psychological, and access to service, protection, and dependency. So these are the five areas that we focus when it comes to child specific issues. They also relate to household and women. Is it not moving? Yeah. So UNICEF commitment about this, I've mentioned few things. I will not go, but we have dedicated goal area 5 to work on social protection, where we are uh, focusing on the SDGs and humanitarian summit commitment and cash transfer program, cash plus approaches, core commitment for children, which are all mentioned. Now, a programming approach that has across the life cycle approach, we work at administration policies and program, and evidence-based is our major thing. Three expansion strategies that UNICEF promotes, and I think it's common globally. One is that who is covered, the population, so last mile and the furthest of all has to be covered, and services which risk are covered. So health, nutrition, education, what kind of vulnerability, so risk mapping and risk profiling is very important, and how adequately are risk covered in terms of financing and access to services. Uh, to move further, this is what I have already talked. I'll not go into detail of each of this slide, and which talks about anticipatory capacity and prevention of shocks, and absorptive capacity and adaptive capacity, all this terminology which you all are aware. Before going further, I will just say that all of you have mentioned, and we all know that the loss of life and loss of livelihood and loss of global GDP and countries' GDP is huge. And as Yashwant has mentioned earlier, and many of you, there is no way out for global community and countries to ignore disaster risk reduction and its linkage with social protection any more and any further. Unfortunately, in India, in particular, countries in this region, and especially in middle income countries, what we have seen is that program that are designed for poor, if I can say, is poorly designed. So it is a very common feature. Whatever you design for poor people, you design it so poorly with lot of conditionality, lot of administrative challenges, and it tends to exclude those who are mostly in need, be the woman with a person with disability or children or people in difficult living conditions. Some of the good practices programmatically and financially, which I have mentioned here, that we can share further detail, which is in Mongolia and Philippines. Both have shown a very great system in terms of shock responsive social protection and disaster risk reduction, including Ukraine and Democratic Republic of Congo. UNICEF has specific reports on Afghanistan, where we supported after the disaster risk response, and there are also successful story even in a country like Afghanistan, where no system worked, and because of the transition to new government, still there has been operational system successfully placed, which is delivering services to the last mile, especially children and women. So that case study also can be shared separately. uh, so I think from all these case studies, what I would like to highlight as some common features that are important for policymakers consideration is is uh, one is the two-pronged strategy. So humanitarian assistance or humanitarian response, linking them to existing national social protection system. That's very, very critical if countries need to respond. Other one is universal and life cycle based approach to vulnerability, that is including health, nutrition, skill development, and through the adulthood and others. Universal social security benefit to the household. Community engagement, many of you have highlighted, and UNICEF with its own support across the region and globally is a strong advocate of community engagement and building this system and cadre of social protection worker and everyone who can be part of the feedback and grievance redressal system, because no matter how good system is, still the efficiency of these systems are challenged at the local level. Cash plus is something that we do emphasize due to existing social gender and behavior norm, especially in this region and India. So that is our major support. The whole province approach, rather than rural, urban, and dividing so much segment, is also something that we do not support. Gender and disability sensitive targeting across social protection is critical for UNICEF's advocacy and central to our inclusion agenda. Now coming to disaster risk financing and some evidence and lessons, the UNICEF report that I have just pasted the cover page can be shared with you, and there are a lot of good lessons and important evidences backed by robust evidences, which offer a lot of food for thought in terms of public and fiscal policy making, and also inputting into COP28 agenda, which we also are pushing as a UN agency, but also through your forum if we can. So potential disaster risk fund provisions, what we see some of the gaps and opportunities. I have listed few. There are many, at least 14 areas we have identified. So one gap that we see, development and coverage of regular social protection system remains fundamental to shock responsive social protection. You take up any program, if I take the example of India's social protection system, like in National Rural Employment Guarantee Scheme or public distribution system that, or take home ration or and Janni Suraksha Yojana kind of maternity benefit, even these best near universal program have also not demonstrated and are limited in terms of their reach beyond 70% of population. And when you dig down, you realize that at least 30 to 40% people who are not reached are those who are most in need and most poor due to conditionalities. So there are opportunity to advocate for improving, making universal social protection universal and integrated rather than having a scheme-based approach. How much time I have? Then I'll go quickly.
Veena ji, I think we are a little short of time.
Okay, so then I will share
Yeah.
the PDs, this PPT already with you. I'll just go. These are some of the big gaps and opportunities as highlighted, is backed by the study in Asia region. These are some of the pilots which are supported, which you can access, and we can provide UNICEF link for these good practices to be seen. Some of the initiative which are mentioned here on the regional, that's are also for your reference, including anticipatory social protection. So for us, we use term shock responsive social protection, which is used in various way, like disaster risk responsive social protection, anticipatory social protection. We don't believe in terminology. We use shock responsive social protection, but it means all in the same. So Philippines one, definitely I'd like all of you to definitely look at in case you are interested. In terms of financing, these are the 5 areas that needs to be considered. Any financing strategy by country or even global advocacy. Now, key dimensions of disaster financing, which I mentioned here. Now I will come to the last 2 slides where disaster risk financing, some way forward and recommendation that I am sharing with you and this group for your consideration, and we can take it forward as appropriate. So one is building mainstreaming shock responsive social protection as a system into policy agenda within the core social protection system. Adaptive resources which can advance shock responsive social protection, which means there has to be innovative financing, because regular financing and is very inadequate, and governments during COVID time have demonstrated some ad hoc approach which needs to be streamlined, which means need for additional fiscal space and financing. Alignment for the mechanism with the disaster risk responses, as have I already highlighted. Risk utilization of fund, again, first is that sometime the fund is not dispersed timely, and that also causes poor utilization of resources, and then going back saying that because fund is not utilized, you don't get disbursement. So these are the fund flow mechanism also has to be seen, how it can be improved. On programmatic fund, to reiterate, placing social protection central stage, leaving no one behind, effective social protection programming, delivering anticipatory social protection, multidisciplinary and interoperable social registries, some states of India are already doing, and national level advocacy must happen, and also global like financing for social registry is equally important. Community systems and action, and fully institutionalized vertical and horizontal coordination, including portability, has to be critical consideration for the national government and global stakeholder to push it for sustainable financing agenda during COP28. These are some UNICEF resources that are available, which includes all the details which are presented, including the good practices. I'll be happy to share if required. Thank you very much for this opportunity, and happy to engage in any further conversation. Thanks a lot.
Thank you, Veena ji. I know I mean, each speaker, the topics covered are huge topics and very complex topics by themselves. So, and we have really a very short time. We will now move to the final panelist, Mr. Shubham Tandon, Project Officer, Resilience with UNDP. He's an enthusiastic development professional with more than a decade of working in the environment sector. He will be talking about he will be providing his insights about inclusive disaster risk reduction and climate action. Over to you, Mr. Tandon. Please take the floor.
Thank you, Annie, and thank you for inviting me here. A very interesting discussion happening of all the point, Dr. Hans and Dr. Ghosh, Shailendra, everybody talked about. And when Shailendra started talking about the change in temperature, specifically the climate change, we are already talking a 3-degree rise. The UN Secretary General talked about the era of global warming being over and the global boiling is started. Amidst this, the number of disasters have been increased, the frequency has increased, the intensity has increased. And when we are talking about as the entire South Asia region, we need to make sure that the inclusivity also increases in a bigger and a better way. I guess the idea now should be that we are all well aware of the problems which exist. We have some brilliant case studies and best practices available throughout, and we need to build upon it and take it forward. I will talk about a couple of things which we have been doing in the sector specifically. To start with, there was this one project which we implemented in Himachal Pradesh, where the idea was to develop disability inclusive disaster management plans. And although earlier we used to have these cross-cutting issues of disaster management as a very important part of the DM plans, but recently that component is being reduced somehow. So what we did was we developed a DM plan which includes disaster inclusivity, this disability inclusivity, and we also came up with an investment plan for the city. So we told municipal commissioners and the city administration that this much money will be required if you want to make the entire city inclusive. And the case studies and examples came actually from our office as well, because we have been trying to make sure that the entire UN house is inclusive of gender, inclusive of disabilities in general. So that component is one thing which I guess can be replicated, because a lot many times what happens is sometimes there is a huge influx of funds, and with the 15th Finance Commission and the windows on mitigation, adaptation, and rehabilitation coming in, state governments are also looking for projects to implement. And if agencies and on ground CSO partners can work with state governments and develop such projects, I guess we will be able to demonstrate these good practices on ground as well. Another thing which last year actually we conducted these school mock drills, disaster management mock drills for students with disability in Andhra Pradesh. And this was first experience for me. I have been doing this for almost a decade now, but reaching out to students and to understand how they are taking things forward, how the last mile response is coming in, how the basic early warning system is being detected, was something very interesting to sort of take things and understand what is required actually on ground. Um, to my surprise, conducting a mock drill with these students was far easier than when I conduct a mock drill in a school in general scenarios, and I was amazed to see the valor, the idea in which the students were working, coordinating among each other. So when we are talking about inclusivity, be it gender, be it disability, be it any inclusivity, I guess the important is to understand what is the requirement, what is the people who are looking towards it. Similarly, we under one of my urban resilience component, we developed these psychosocial support care givers under one of our urban resilience component, and this was done for 10 cities, out of which 4 cities were where we specifically design interventions around disability, specifically where these master trainers reached out to individuals who were disabled in one on the criteria specifically, and in a post disaster situation as well. So a live example can be actually 2 cases where we worked after the Kerala floods and also after Cyclone Fani. And these master trainers who were trained to reach out to and deal with individuals who require a certain attention specifically, it was overwhelming to see how everybody was responding. So probably when we have been talking about the entire version of inclusion per se, I guess it is also important to assess. I hope we have more people here who have been associated with people with individuals who have a certain issue around working specifically. But as I say, when and I was just going through the number of participants, I guess we need to also have a very inclusive gender balance here as well. I see a lot of male colleagues here talking about inclusivity in general, although the panel member were very the panel member although had a lot of female interventions in general. But also a very interesting activity we have been implementing. We did this with Nihans for around 6 cities, where apart from the psychosocial support, we also trained students in who were pursuing their diploma on disaster management planning and the entire mock drill conductor. So they became the master trainer to conduct mock drill in the cities. Now, again, a very interesting intervention where we, instead of talking about inclusion, we started talking about response, and response in a way where the individuals were taking the lead to take things forward. So as the sort of panelists in before me have specifically talked about the issues around patriarchy, poverty, high violence, and each and everything, all these issues exist. I guess it's time we come towards and start working on finding solutions and implementing it on a bigger level. Why not come up with a regional program uh, specifically for the Asia Pacific region, and the UN bodies can come together, the government can come together and start implementing. Let's try to get a few pilots done and tell the government that this is possible. Because and this is my personal opinion, if we talk about the country itself, India itself, there is no dearth of money about implementing the projects. So if the project is good, even the government is now looking forward to get these implementations done. So I guess it's high time we as a society, as a civil society members, we start coming up with these best practices, these solutions, which can be replicated at a higher level and a bigger level and a larger level. Pretty much that is it from my end. Thank you.
Thank you so much. Thank you so much, Nathan, for these very, very interesting examples, and for your for really encouraging to take it on, for your suggestions to take it forward in terms of replicating it more. I mean, have scalable options basically. We are quite we are way past our time. We should have closed the panel now. But I think we might we would, if you're okay, then it would be good to take a couple of questions from the audience, if that's okay with you. Can the panelists stay for another 10-15 minutes? Is that okay?
Sure, I can be here for another 5 to 6 minutes. I need to jump into another call, so more than happy to take questions.
Yeah, we are here.
I can stay.
Thank you. So, Michelle, could you help? I think there are some questions in the chat that if we could take them up first.
Yeah, we can.
Please go ahead.
Yeah, thanks, Annie. So we have a question for Aditi on if you can share your learning on anticipatory action, if it's related or effective to any specific hazards like floods or cyclone surges. I'll also take like a couple of more questions, and then we can have a round of responses from the panelists. And then we have a hand raise also from the participants, so then we can go ahead with that. So the next question is not addressed to anyone in specific. If there are any livelihood strategies for the most vulnerable groups having disabilities, particularly in the changing climatic conditions, except some financial assistance. So any of the panelists can take this question. I'll take one more question. If any plan to include malnourished women for nutrition supplementation, if this has been included, and since we are seeing only IUTF for 0 to 59 months children. Yeah. If we can have responses from Aditi and like any of the other panelists.
Thanks, Michelle. Let me go first. The specific question on the very good questions on the anticipatory action. I guess except probably earthquake, for any other hazards, we can think of anticipatory action, because we always get 3 to at least 10 days of kind of a lead time to take this anticipatory action, including conflict, because there are already, the conflict doesn't erupt automatically. You always know that it builds up over a couple of days. So I probably, except earthquake, I can think of doing the anticipatory action in almost all kind of crises. Thanks.
Would you like me to take on the livelihood one?
Sure. Please, Dr. Asha.
Yeah. See, when you look at even the 10-year-old census data, it said 36% of persons with disability are workers. They are workers. And out of which I think women were about 23% only. So when you go to the disaster areas and you're talking about climate change, I think the figures are phenomenal. It's like a zero kind of livelihood, at least what we've seen in the field. Maybe the maximum might be 5%. For that, you need a strategy which is all-inclusive. But in India, we still don't have all-inclusive strategies. We are looking at adaptation. The ones that I showed you are basically government, non-government inclusive. But I don't think that there's any policy at all yet in place. But we need to do that, because otherwise the people who are being displaced, so many people being displaced with climate change, are dying of hunger. And I hope that answers. If anyone else has something else
I
to
would
add.
like to complement what Asha ji is saying. One is that yes, livelihood, but when disaster or any kind of catastrophic effect or large scale disaster happens, livelihood and income and employment is the biggest casualty. And given that 90%, 80+% people are in informal sector, mostly women, they are highly vulnerable with no social security support. So one and for all the stakeholder, what is needed to advocate for some bare minimum cash transfer during disaster, and that is something that we are advocating with the Ministry of Rural Development, supplemented by our studies of NREGS and few other NRLM. When it will happen, we don't know, but I think this is an area, because even if you can't mix the two, providing employment and income security, because income security is the way to ensure access to certain basic services when they are hit by disaster, and it is high impact on those people. So I think I agree with all the point that Asha ji mentioned, but universal social security, supplementing family income for women is the only way for all countries, including India, to go for anticipatory social protection. There is no other way that you can think of providing income support to families when they are hit by such crisis of this scale. Thank you.
Thanks, Dr. Asha and Veena. We have the next question from Aniruddha. Since he's here, maybe you would like to pose the question directly to our panelists.
No, it's to Asha ji. Thanks for her presentation. And I'm really thankful that she is the only person who had formally mentioned that displacement issues. And displacement, it is disaster-induced displacement, and which is missing everywhere. And we are talking about development-induced displacement. And for that, there are entitlement matrices. And these similar kind of entitlement matrix we need to develop. So that is what is missing. So I really believe, and I really would like to help, and I have been working on this. So I really loved that you have mentioned this one, number one. Number two, Michelle, I am just putting my this thing, questions and suggestions at the same go. Is that okay?
Sure, but since we are overshooting, if you can be brief about it, it would be great.
No, it is brief. That the last speaker who has talked about mock drills, maybe his experience I have written in chat box, you will see. So it is, he has said about mock drills, but mock drills where? In which school? Is it in a public school or in private schools? In private schools in the rural areas, mock drills are not solutions. So that is what my feelings are. I do not know what are the experiences of the August panelists. My feelings are, in those areas, can we think of something like, in the rural areas, they do not have sports accessories. They do not have any entertainment facilities. So instead of mock drills, if those issues can be included in their games and sports activities, and they can be engaged and encouraged to do that, I think that would really give us some result. Otherwise, school-based programs may not be a solution. That is what my feelings are. Thank you.
Thank you so much, Aniruddha. If any of the panelists would like to respond, or I can hand it over back to Annie. And any further questions, we can address them by email also. So please feel free to drop your questions in the chat box.
I'll just say one sentence, that in the areas where I work on coastal erosion, there are not even schools there. What do you do under, they're just coming up. So under such circumstances, the community is the only answer.
colleague from UNDP presented this one mock drill thing, and it may not be a bad idea. It may not be feasible in certain situations, but it's good to have certain kind of such mock drill in rural communities, in schools, because not even in urban areas, which is very congested. So many flats, many communities are not aware whether their fire extinguisher is working, their system is efficient, that they need to use staircase or flats. So this could be, but I agree with Asha ji and other colleague that mock drill may not be solution in all the situation, but like skilling your kids and young people about these things could be a good strategy to also empower them to know what are the options. And I think UNDP colleague mentioned about this mock drill. Maybe if he's still available, can explain.
Veena, I agree
No,
with you
Mr.
completely.
Shubham has left. So
Okay,
my
okay.
point is that can we think of communities? Because every time we have been talking about schools, 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 and that is not the solution.
You are
Everywhere
right.
that we are enrolling, that is everything is fine. So we need schools for education, but for mock drills and other things, apart from their courses of studies, so school authorities, they are not actually coming forward to accept all these things. So we need to think of engaging communities in those type of activities. That's what my suggestion was. Thank you.
Thank you, Anirudhji. Completely, your points are absolutely well noted. And without community mock drill, community-led mock drills, doing standalone school mock drills would not be a way forward. So both need to kind of feed into each other. Thank you, everyone, for especially thank you to the audience for the questions. And I'm sure you'll have a lot of questions. Lot more questions that are there, and these kind of questions kind of really stimulate. It's good to have diverse views and to make each of us think about what we are doing and what we are saying. Basically, unfortunately, we are really short of time. So, in the interest of time, I will try to conclude this by asking
Annie?
all my. Yep. Yes.
Yes, Shailendra had committed to talk something about COP28. If so, are you skipping that, or maybe 2 minutes you can give to him and then conclude? If everyone is in agreement, it's good. It will be good to hear. But I leave it to you. You are the boss.
Shailendra-ji, you would like to speak a little more about COP28?
At this point, I know people have stretched their evening, and I can just go on and on. COP28 is above us, but Asha ji is here. She's an advisor at the COP, and I would actually like to hear from her because she's expert in this subject. Mine would be a more broad, where we are at the negotiations, and frankly, it's one step forward and 5 steps backward. As always, this COP, the only demand I think the civil society is going in with is climate finance, because that is the only thing will enable climate action, whether it is for adaptation, whether it is for disaster risk reduction, whether it is for loss and damage. So without going much into, we know that there is not enough money on the table, and we expect the Sultan Al Jabr of the oil company called ADNOC, who's heading these negotiations, to at least put his money where his mouth is, because he's been saying that he wants a very, very successful COP. So, Asha ji, I will leave it to you to go into the specifics if there are any. Annie, Veena ji, thank you. I hope that gives you a direction of where we are at. Thank you.
I think the basic problem with COP28, you mentioned it, is that it's not a human rights approach anymore. Why do I go? Why do civil society go? I might be an academic, but I'm also a human rights worker. So, if there's no space, there was nothing in Sharm el Sheikh, and it looks like it's going to be bad even in Dubai, then, we've lost half the battle. It's not only money, the fact that we can go and talk there, we can make our demands heard. Otherwise, we are speaking to each other. That is the biggest problem. In Sharm el Sheikh, we had huge corporate money floating in. And I'm sure it'll come at Dubai. Though their halls were empty while ours were overflowing, but still, you have to make some kind of decision on what are we looking for in COP. That is not being made. And from the disability sector, if I cannot go into a room, then it doesn't matter to me whether I come there or not. These I think are pointers that we need to work much more harder before the COP than during the COP.
Absolutely, Asasi. I actually missed mentioning that we hope that this COP, the least it can do is lead by example and make it disability friendly, especially after what we saw at Sharm el Sheikh. So I think that's how low the bar is, Annie. That's how low the bar is, Veena. We are going there with very low expectation, with 27 years of broken promises and undelivered pledges. So, we are literally at whatever you can throw at us is progress forward. Thank you.
Thank you. So probably we should, what I would like is maybe a concluding sentence from each one of our panelists about any one of your recommendation or your key takeaway points from this panel going towards the COP28. We start with you, Aditi. You're on mute, Aditi.
Yeah, sorry. Yeah, South Asia, we know, is home to 600 million children, and it's among the most vulnerable globally to the impact of climate change. And the increase of severe weather events is actually impacting the poor and marginalized children and their families getting the brunt of it. And let's recognize that huge inclusion gap exists. And when we're talking of climate crisis, we cannot discuss is without discussing the gender, age, disability, ethnicity, and all this, how the impact, all this impact, the access and the barrier they face. So I think that has to be there. Gender mainstreaming probably sometimes got little bit, but still disability inclusion remain as a very expert topic. It never get mainstream. It always remain, oh, this is too difficult, let the expert organization work. What I want to understand, just let understand there are person with disability, and if we do not know how to include them, just ask them. But if we can't do anything, let's be aware that they do exist and they are part of us, and 15% in world population are with person with disability. Thank you.
Thank you, Aditi. I now pass on the mic to Kennedy. Kennedy, for your key recommendation.
Yeah, thank you, Annie, and all the panels. So I think when we talk about climate justice, like we should also acknowledge the importance of disability justice. Disability justice means the climate justice. So one thing I would like to recommend is like share is like apart from accessible and inclusive environment, in addition to accessibilities to informations and communications, and we can say like the future is on the inclusions. Yeah, thank you.
Thank you, Kennedy. I hand over the mic to Veena Ji.
So, okay, so I agree with all the other panelists, what they mentioned, but I'm a strong believer of advocating for universal social security and universal social protection. As long as we keep talking about segments like disability, gender, there is tendency to dilute, because as I said, the program, when you decide for certain a small percentage of poor population, you design very poor program. So there can be the design issue, which is contributory and non-contributory. Veena is earning 100 rupees, she can afford, she can contribute, while Reena is not earning 100 rupees, she can be non-contributory social protection beneficiaries. But there is need for all the countries to consider progressively universal social protection for all, and have a universal social security, social transfer for those like women, especially women with young children, single women, persons with disability, and some most vulnerable criteria that can be worked out by the policymakers and community practitioners and activists network, where you can provide real some great universal income to those families who are most vulnerable. But universal income support, universal social security, to me is the key. And least we talk about segmentation is better for us. Otherwise, this is taken for granted always, you know. Why? And they don't form a small, big political constituencies. So I think it's a design issue, whether you go for tax finance or non-tax finance, contributory to non-contributory, but it should be universal and accessible to all. Over to colleagues.
Thank you, Veena-ji. I hand over to Shailendra for his key takeaway points.
My key takeaway, and I'm going to repeat this like a broken record, after listening to all the wonderful work that all of you are doing, how do we ensure cooperation? How do we ensure collaboration? How do we ensure best practices traveling from one place to another? I think that is our main responsibility. There is no time for us to sit in our islands and, just promote our solutions to our communities, but take them further, scale them up, because that is the need of the hour. And I would really, so much I have learned today. I would like to also say that we have to come together as some kind of caucus across climate and various development and other this thing, to present ourselves together on these important issues at the COPs, at these international negotiations. At present, we are not. We are different voices. We are coming in different news. So that's where I would, my key takeaway and my message. And at Cancer, we would try and work. Some of my colleagues are here, to how do we bring all of us together to form that caucus, to influence negotiations, to find regional solutions. Thank you, Annie.
Thank you so much, Shailendra. And over to Asha Didi for her final remarks. Asha Didi, you're on mute.
Sorry, I had given 4 key messages which are on my PPT. The first is that we talk so much of biophysical hazards, and we talk too little about our well-being, our capacity to speak. I think that's the first thing that we need to take to the COP. Second is that we recognize that resilience is a right to equality. We have to recognize that resilience has a right to equality. It has a right to speak up. And also my 2 things on disability are that what I said earlier, that you have to give women the right to talk, the right to speak up. And secondly, we have to develop a wider framework of ableism, and specifically eco-ableism, if you are looking at climate change. I think these are also important factors, but the right to talk, I think, is the most important, which might not be there tonight.
Thank you. So finally, I think we don't have Mr. Tandon's feedback because he's left. So I will just a few final words. I think this is a beginning of coming together as different organizations, as different institutions from the region, to discuss on inclusive climate action and resilience building. And I think we all appreciate that inclusion is a process, and that today we're touching upon a few elements of social exclusion, but there are many, many more factors, and that we really need to understand vulnerability in the context of disaster risk and climate risk. And as all of you have spoken, that we need to appreciate that working together and collaboration will help us learn from each other, have a unified voice, and as Veena-ji said, have a universal, rather than having like small programs, better to have a universal package to really push for the agenda of no one left behind. So with this, I would like to thank the audience, my esteemed panelists, and hand it back to Michelle for her closing remarks. And a lot of apologies for the delays.
No apologies. We are working for those who require us, so it's okay. Asha ji, over to you, and nice meeting to all of you.
Yeah, all of you.
Thank you so
Thank
much.
you, everyone.
Yeah.
Thank you,
Yeah.
everyone.
Nice
Thank you
meeting
so much
you.
to all the
Bye.
panelists and all the participants for engaging with the session and also staying despite the delay in the session, and yeah, for actively participating and putting up your questions and remarks and suggestions. We will share the event recording and all the collaterals, including presentations by the speakers, with all the participants over email. So if you have any follow-up questions or if you would like to reach out to the panelists, please let us know, and we will connect you with them. And thank you so much, Annie, for moderating. And thank you to once again to the panelists, Aditi, Annie, Veena ji, Asha ji, Candy sir, and also Shailendra. Thank you so much. And Shubham, who had to jump for another call. Thank you so much for joining us. It has been a very insightful session, and we hope to keep the conversation going.
Thank you all. Thanks.
Thank you.
Bye. Thank you,
Bye-bye.
everybody. Have a
Bye-bye.
nice evening, all of you. Bye-bye.
You all. Thanks. Bye.
Thank you, ma'am. Thank you so much.
Thank you so much, Sana, for Sana. Hello. Yeah, Sana, thank you so much for doing the interpretation today. Yeah. Thank you so much. Yeah, thank you.
मैम आगे भी इस तरह के कार्यक्रम अगर हों तो इसी तरह सूचित करते रहें आगे भी जुड़ना चाहेंगे आज का भी कार्यक्रम काफी महत्वपूर्ण रहा आपके तमाम आयोजकों को और मेरी तरफ से टेक्निकल टीम को भी बहुत बहुत धन्यवाद
Thank you, Sonu. It was nice hearing from you.
बहुत अच्छा लगा मैम एक चीज तो बोलूंगा कि जब मैं फर्स्ट बार जुड़ा उसके बाद से लगातार मेल पर जानकारी यहाँ का मिलता है और मुझे जुड़कर बहुत अच्छा लगा क्योंकि यहाँ कुछ बहुत सी बातें जो जानने लायक होती है वो मैं जानता हूँ और कुछ उसे लिखने का भी प्रयास करता हूँ दीदी बहुत अच्छा लगा और इसी तरह अन्य विषय के साथ जोड़ें और मैं क्या कहूँ मेल पर तो जानकारी मिल जाती है और इसी तरह मिलता रहे आगे भी बस यही कोशिश रहेगी धन्यवाद दीदी
Thank you so much, Sonu. Yeah, and very rounded experience. So that was good. And then thanks for